Continuing now with our investigation into the diseases and afflictions of the eye, here's our reporter, Laura Windsor.
Roger, in addition to macular degeneration, other afflictions of the macula can be macular tears or puckers. We asked Dr. Kent Small to explain why these are different than macular degeneration.
Well, one of the things that gives the retina some structure, so it's not just wet, mushy tissue paper kind of stuff, is the blood vessels in it. And right in the very center of the macula, in the fovea, there are no blood vessels. So that is an inherently weak spot in the retina in everybody. And now why some people get macular holes and others don't is debated. But nonetheless, because of that inherent weak spot, when the jelly pulls on that, it can pull a hole in some people. The symptoms of it are just like they are for macular degeneration. And a lot of people come in thinking they have age-related macular degeneration when what they really have is a macular hole. Those are my happiest patients, because macular holes, we can actually cure a macular hole. We can't cure macular degeneration. So the symptoms usually are the beginning of a small smudge spot in the center of the vision, usually with a little bit of distortion around it. And with time, as the hole opens up, it slowly grows up to maybe 0.5 millimeter or so. And with that, the bigger the hole gets, the more the vision declines, primarily just the central vision. Again, the peripheral vision stays intact. It's a little more prevalent in women than men, and a little bit more prevalent in people with pre-existing glaucoma. And we think that with the glaucoma, there's a more weakness in that area because there's a layer of retina that's missing. The treatment for macular hole is interesting. It's surgery. It's a vitrectomy with a gas bubble in the eye. And it was fairly new. The first macular hole surgery was probably done around 1990. And prior to then, we had no treatment for it at all. We just kind of pat people on the back and say, well, gee, you know, your vision will probably get down to about 2200, 2400. You'll be legally blind. And it won't get any worse than that, because they usually kind of grow up to a certain level and they stop. Well, with macular hole surgery, we basically go into the back of the eye with little needle-like looking instruments, suck and cut out the vitreous jelly. And there's usually a little sheet of scar tissue on the surface of the macula that's contracted and pulled the hole open. And so I think it's very, very important to peel that little membrane, that little sheet of scar tissue. So I peel that scar tissue with some little microscopic forceps, tweezers, and then put a big gas bubble in the eye. And it's really the surface tension of the gas bubble in contact with the hole that closes it. And the success rate is 95+%.
He is the only one that can fix this problem. And I had surgery, and he blocked that hole. Now, many years ago. And I don't wear any glasses anymore, except for reading. And I come here every 6 months. He checks to see if they're still blocked, if the hole is still blocked. And it's been wonderful. It's been a rebirth, really. I mean, what can you do without your eyes?
I can explain you how it's the big difference after staying at home and trying to see everything, and my daughter, my son, or my grandchildren, and after that, after the surgery, I saw perfectly, and I almost cry, and I say to my daughter, she was close to me, I said, can you believe it? I can see clear. I can say thank you, God, and thank you, Dr. Small, for that.
For more information on Dr. Kent Small and the Macula and Retina Institute, please call their Glendale office at 818-552-5040 or their office in Los Angeles at 310-659-2200. Or you can visit their website, maculaandretinainstitute.com.